The Institute for Circumpolar Health Research is a northern-based health research institute. We address research questions by building on the strengths and knowledge of all cultures to improve health and wellness. We also take an additional step by doing this within a circumpolar context and recognizing that while we're a northern region within Canada, we also have circumpolar partners and regions which share issues and approaches to health and wellness. We have international partners, national partners, but ultimately the territorial and regional partners are formative and bring knowledge forward and provide solutions for the North and by the North. These include our Indigenous groups, elders councils, schools, health authorities, health ministries, and everybody works together and plays a role and brings unique knowledge in addressing these issues in the North.
Our whole way of life is changing, and we need to adapt to new ways. We need to consider food security, where people have traditionally depended on the land that is quickly depleting. How do we begin to adapt to have food security so our people have traditional kinds of food in the future? The Circumpolar Health Research and the Elders Council, we've been talking together, we've been collaborating on how we're going to do research on these impacts that are impacting our people, and looking at the traditional knowledge that must be part of these research and done in our language and done in our territory, of how we're losing so much traditional foods, medicines, and so on.
Bush University is a land-based university program based in the Northwest Territories. Canada is the only circumpolar country without a university, and this is really our northern response to show how university education can be different, how it can serve community health and wellness and sustainability by taking teaching out onto the land and integrating academics with land-based skills and Indigenous knowledge, and bringing university teachers together with elders, practitioners, and local leaders, teaching cooperatively for our future generations. Dishinta and ICHR work in collaboration to develop health promotion curriculum and Indigenous methodologies for health and wellness. So teaching people basic research methodologies that pertain to health. We do this by bringing together our team of expertise and the team of expertise at ICHR, and with that network of support with archives and university support and elders and PhD students, we're able to really create dynamic curriculum that's relevant and that produces trained Northerners that can support research in the North.
I come from a long background of working on Aboriginal rights issues, and the satisfaction I get from working in a supportive institution like this is I'm able to sit down with our northern PhD students. I pick their brains in terms of what does homelessness mean for the kids today, and what does it mean for our people, and what are the questions around sexual health? You know, it's really community issues that are being addressed with the best brains we have. And there's a real satisfaction with that there are homemade solutions to home problems.
I don't think that we're any different from the South in the sense, like, we have high rates of cancer, we have emerging diabetes, you know, we have respiratory, particularly seasonal and things like this. But I think the health challenges that are really standing out for the North are related to geographical and to culture. Because the North culture is composed majority of the Aboriginal people, meaning Dene, Métis, and Inuit. But then we also have another 100 different cultures of Canadians that are inside. When we look at the different cultures and we recognize that Yellowknife is really symbolic of the international community, that we're very rich, and the Institute of Circumpolar Research wants to tap into that richness so it'll benefit Northerners and then the international community.
The Research Institute is a body that is determined to have excellence at the highest standards, and that's what we like about it. When you talk about preservation of land or having a healthy environment, you've got to have evidence that can't be disputed, and that in turn goes with the science that our people have. It's a combination of Western and it's a combination of Dene science. That's what we like about it, and so We have to ensure that continues and it's used in the realities that we have today.
As we move forward, I think we need to continue to build on the capacity that's been created in the North and articulate the strengths of Northern knowledge, which emerges from the multitude of cultures and knowledge bases that we have in the North. And this will enable us to identify meaningful research questions, creative methodologies to respond to those questions, and then knowledge which can be transferred and inform decisions which will ultimately improve the health and wellness of residents living in circumpolar regions.